but going out where you actually have the opportunity to meet people and engage them in a conversation about their health is another pathway that, if you're willing to do it, can bring new patients in the door.
Welcome to AMC. I'm Dr. Greg Miller. Have you heard of the town square concept? Today, Dr. Bill Kriva is going to break down this powerful marketing tool. You won't want to miss his comprehensive list of example promotional events. If you find this video to be helpful, please click the like and subscribe buttons. Let's get started.
Hello, my name is Dr. Bill Kriva, and I am an instructor and a mentor for Aligned. And I wanted to just take a few minutes to talk with you about a concept from a marketing standpoint that, if you get the concept and implement it in your office, can be extremely powerful. And it's something called the town square concept. Now, what does this mean? This means that if you think of your office as being at the center of town, and that all of the roads that come into the center of town come towards your office, then you have a town square practice. And every single one of those roads that comes into your office is a different pathway that people can utilize to become a new patient in your office. And these can take many, many different forms. And when you're talking about having a lot of different ways to reach the office, the more that you have, the more new patients you're going to get. It's just a simple relationship there. And likewise, the more that you decide you're not going to do or that you're not willing to do, the fewer the paths you're going to have for people to find their way into your office. So the idea is to have many, many different ways that people can find their way to you. So what are some of the things that you can do? Well, obviously, we've talked about this for many, many years. Going out and doing presentations in the community, doing health talks or lectures on health-related topics, and becoming the authority in your community on health-related topics. And as a result, when you meet people at these talks, you can bring them into your office as patients. They get to meet you and decide that they'd like to become a patient. Another way to bring people in is to go out and do screening events in the general community. You can do community events, for example. A lot of times in the summertime, there's community festivals that are going on. But going out where you actually have the opportunity to meet people and engage them in a conversation about their health is another pathway that, if you're willing to do it, can bring new patients in the door. How about electronic media? For example, your website. What is the face of your practice out in the electronic world, out in the internet? Is it something that's attractive? Is it something that people want to interact with? And if it is, does it also inspire them to want to sign up for an appointment and come in and see you at the office? So you've got that. Your website is your face in the electronic world. But then also things like Facebook advertising, Google AdWords advertising. There's a lot of different approaches you can take. Again, different avenues to get into contact with people so they can find out more about you and what your practice is all about. Also, everything I've talked about so far is outside marketing, but you can also do internal marketing. You can do internal events to generate referrals. We do periodically events that are designed to have some fun in the office for holidays that are not the typical holidays, okay? We may do a promo for Easter. We may do a promo for St. Patrick's Day. We may do a promo for the 4th of July or for Thanksgiving, that are designed to basically interact with our existing patients and give them an incentive to refer folks into our office as a part of the promotion. And as a result, we clean up a lot of the referrals that are hanging out there that are kind of on the fence. This gives them the incentive to come into the office. So doing internal promotions, doing things like a condition of the week board. When patients walk in, there's a different condition up on the board, and having conversations with them about those conditions and then generating referrals off of that. Mailers, okay? Periodically, you can send out mailers throughout the course of the year that provide an incentive for people to refer, and for those referrals to come into your office, possibly for like a special event or something like that. So again, internal marketing and external marketing. And here's another thing that's really, really important. Throughout the course of the year, different things are going on. I practice in Minnesota. And obviously in Minnesota, in the wintertime, the outdoor community festivals are not happening, right? So we do the outdoor festivals in the summertime. In the wintertime, we do more of the health talks. In the summertime, people don't necessarily want to come to health talks as much, but they definitely don't have anything else to do in the wintertime. They're very happy to come to the talks, particularly now that COVID is over with. So throughout the course of the year, you need to tailor your marketing campaign and ask the question, where do people gather right now, in such a way that I can engage them in a conversation about their health? And the answer to that question is where you need to put your marketing efforts. Another thing is to have this planned out in advance. You should have a 12-month marketing calendar where you already have events and opportunities to meet people planned out, your internal promos planned out, and you've got that in a calendar. We actually do this with the Google Calendar, which works pretty good. And that way, you constantly have something going on from a marketing standpoint. You should have one or two things going on every week that has the potential to bring new patients into your office. And if you do, you're going to have that nice steady stream of patients walking through the door. So I hope that this helps. The concept, the town square concept, the more pathways that you open up for people to find their way into your office, the more new patients you're going to get. Internal and external marketing is very, very important, internal to the practice as well as outside the practice, and making sure that you've got a plan, that you've got a marketing calendar lined out in advance so that you've got a consistent stream of things going on. I hope that this little brief discussion is helpful for you, and I hope that you are able to attract more new patients as a result. Be blessed and take care.
Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text us at 904-966-4996 for more details. See you next week.